Welcome to the U.S. Healthcare System Lecture Series by Monika Wahi, based on Essentials of the U.S. Healthcare System by Shi and Singh. Welcome to the lecture over Chapter 2, Foundations of U.S. Healthcare Delivery. In this lecture and this chapter, you will get an overview of how healthcare is delivered currently in the United States. Chapter 2, Foundation of U.S. Healthcare Delivery. Learning objectives. At the end of this lecture, the student should be able to name at least one definition of health and which organization has put it forth, describe what holistic medicine is, list at least 2 determinants of health, give an example of how American values have influenced the U.S. healthcare delivery system, and finally, to be able to describe at least one strategy used in the U.S. healthcare delivery system to improve health. This section proposes a holistic approach to health and to healthcare delivery that focuses on not only curative medicine, but also health promotion and disease prevention. As was discussed in Chapter 1, the U.S. system has focused on curative medicine. This has been partly due to the focus on cool technology and fancy drugs. But now there's becoming a recognition of the benefits to society from the promotion of health and actually preventing disease. So in this context, the issues of equity in the distribution of health services come up again and again. We look at them by using the theories of market justice and social justice. Different definitions of health. Definitions of health are based on values and beliefs. So therefore, different groups have different definitions of health. The U.S. healthcare system reflects the American values and beliefs. That's why the system has remained mostly private. It is not tax financed as a national healthcare program the way other countries do it that are developed like us. There are strong forces culturally in America against making fundamental changes in the financing and delivery of healthcare. It presupposes the existence of illness and disease. Healthcare in the U.S. is crafted around illness and disease in fixing it, and it uses clinical diagnosis and medical interventions to treat these diseases or these disease symptoms. So, since I was saying that the definitions of health are based on values and beliefs, using the U.S. system of values and beliefs, optimum health exists when a person is free of symptoms and does not require medical treatment. So if you think about that, that is a very individualistic way to look at it, that you're fine unless you're sick. Illness and disease are not the same thing. Illness is a person's own perceptions and evaluation of how he or she feels. A best way to describe it is if somebody says to you, "Oh, I was just sick when I heard about the Boston Marathon bombings." It's because that person feels an illness. Their perception and evaluation is very negative. However, I doubt that person really went to the emergency room because they were just sick over such bad news. Disease, on the other hand, is determined by the medical professional's evaluation rather than the patient's that requires therapeutic intervention. So while somebody may be just sick to hear that news, they won't be treated in the ER because a medical professional would not see them as having a disease. There are 3 kinds of diseases you can have. You can have an acute condition, which is relatively severe, episodic, short, often treatable. That's what emergency rooms like, and that's what the rest of us like. If we're going to have a disease, we'd like it to be quick. I'm going to jump down to chronic condition because we are more familiar with that. That is less severe but of long and continuous duration, where a patient may not fully recover or may never recover. In cases like Crohn's disease, Alzheimer's disease, those chronic conditions are pretty much chronic. However, sometimes acute conditions can move into a subacute phase between acute and chronic, and has acute features, but it could become chronic. If acute moves into a subacute condition, you really want to keep it from becoming a chronic condition. However, all of this is in the realm of disease. We haven't even really talked about illness because we don't know much about illness in the United States since we are so focused on disease. Indicators of health are measurements you can take to see what the level of health is in you or another individual or in a population. For example, self-reported health status. You could survey a population and ask each individual how healthy they felt, whether it was very good, good, fair, or poor. And then you could see the proportion of people who said fair or poor, and you would get worried about them because that would be an indicator of ill health. Life expectancy is another one of those. If you look at life expectancy in various developed countries and compare them, you can see who is winning and who is losing. Morbidity is a fancy word for disease. Looking at the level of disease in your population and what diseases there are can be an indication of the health of the population. Mental well-being and social functioning are two other things that can be indicators of the health of an individual or a population. Functional limitations refer to limitations to being able to do what you want to do, work, have fun, spend time with your family. If you have functional limitations, and a lot of people have functional limitations, you end up with a very kind of sad population. They don't have as high level of health. There's also disability, which must be measured, because the more disabled people you have in a population, the lower level of health you have, and the more you have to work on that. Finally, we get more attention these days to spiritual well-being. People who are not at peace are not doing as well health-wise. And so we like to measure spiritual well-being as also an indicator of population or individual health. Quality of life is a wonderful concept. It's a concept used to capture the essence of overall satisfaction with life during and following a person's encounter with the healthcare delivery system. This concept needed to be developed, and we needed to come up with measurement instruments for it, which we have been doing for the last 20 years. It's very good that we did that, because before then, we were only measuring how well healthcare worked by how well procedures worked. If an operation took place and it healed nicely, we said it was successful, even though maybe sometimes the patient was very unhappy with the operation and lost function, had a functional disability afterwards. We were not measuring quality of life. Now we do a better job of that, because we have to make sure that when we deliver healthcare to a person, we improve or at least keep as much as we can of their quality of life. The quality of life indicator of how satisfied a person was with experiences while receiving care is important. You can consider comfort, respect, privacy, security, autonomy, all the different things that make it a good experience to receive healthcare. The goal is to have a positive effect, a positive net effect, on an individual's ability to function, meet obligations, and feel self-worth. In striving for health, different organizations have come up with different definitions of health. At the more physical view is the medical model. This is what we basically have throughout our U.S. healthcare system. This defines health as the absence of illness or disease and focuses on diagnosis and relief of symptoms. It really doesn't get past those kind of indicators, like simply relief of symptoms. It does not go into things like spiritual well-being. Whereas a medical sociologist or the social view defines health as a state of optimum capacity of an individual to perform his or her expected social roles and tasks. It's more of a functional definition, and it looks more to a person being able to do what they like to do. The Society for Academic Emergency Medicine is more correlated with the social view in that it defines health as a state of physical and mental well-being that facilitates the achievement of individual and societal goals. It adds a state of society in there. It emphasizes both physical and mental dimensions of health. Now we move on to the World Health Organization, which has to really consider the whole world when making definitions. It defines health as a complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. How different that is from the medical model. And this World Health Organization definition is referred to as the biopsychosocial model of health. It's really a very comprehensive idea that meets with that first slide on indicators. Holistic medicine has another definition of health, but again that emphasizes the well-being of every aspect of what makes a person whole and complete, and doesn't just focus on illness and disease. And this incorporates the spiritual dimension as a fourth element in addition to physical, mental, and social aspects necessary for optimal health. Now that we've looked at different ways health is defined, let's look at different things that determine health. There are four main categories of health determinants for both individuals and populations that are outlined: environment, behavior lifestyle, heredity, and medical care. In terms of environment, this refers to not only the physical environment, but the socioeconomic, sociopolitical, and sociocultural dimensions of that environment. Imagine a physical environment of an office. Many people are in that office. However, it matters what year it is, who's president, who's voting. It matters what's going on in the background. Are there hurricanes? Are there a lot of people losing their jobs because of a recession? So environment means all kinds of environments. These can determine how healthy people are. Behavior and lifestyle matters. We all know that diet and foods play a major role in significant health problems and good things about health. You can use exercise to improve health, you can quit smoking, and you can address stress levels to affect your health. Most of the time, behavioral and lifestyle determinants are affected by individuals more than big groups. Heredity is a very personal determinant of health. It refers to a person's genetic makeup. People's heredity predisposes them to certain diseases. However, if a person is aware of certain predilections that they may have inherited, they can opt for changing their behavioral lifestyle determinants to try and comply. Also, current lifestyles can impact future progeny, especially if you're a woman and you're pregnant and you have some sort of lifestyle that affects the fetus. That's where heredity comes in as an important health determinant. Finally, we get to medical care. Access to preventive and curative health services is another determinant of health. So if you think about it, some of these determinants you can do something about as an individual. Some of them you can't. And some of them you can best do something about as a government. Think about environment. Think about medical care. You would have to be a pretty big organization to affect an individual's health at that level. Here are some more health determinants that have not been grouped into those categories, but you can group them for yourself. Physical activity, how overweight or obese a person might be, or a population, how much tobacco use is going on, and this is not just smoking, but also oral tobacco use, substance abuse of all kinds, alcohol, illegal drugs, prescription drugs. Responsible or irresponsible sexual behavior can create morbidity, like sickness, and mortality, which is like death. Overarching goals of Healthy People 2020 include attaining high quality, longer lives free of preventable disease, injury, and premature death. That calls to mind those determinants. Achieving health equity, eliminating disparities, and improving the health for all groups. That also calls to mind some social justice. Creating social and physical environments that promote good health for all. That reminds us that maybe the government might be better at doing that than individuals. And finally, promoting quality of life, healthy development, and healthy behaviors across all life stages. And in that, they probably mean we all should be working on that, with individuals quitting smoking and doing their exercising, and having primary care and specialty care come to their aid when they need medical care. The next strategy we will cover that the U.S. uses to improve health is modifying distribution of healthcare and insurance. As I recently mentioned, we're talking market versus social justice. As I described before, the whole concept of market and social justice needs to be tapped into because we have to ration healthcare. We have to find a way to equitably distribute it. Since our government's not doing it, how do we do this? The production of distribution and consumption of healthcare must be also perceived as equitable by our whole population. Obviously, no society can be perfectly equitable, but their population has to buy it, right? They have to feel that it's fair. Any method of resource distribution leaves some inequities, so how do you decide? A theory of justice is needed to resolve the allocation of healthcare. So you have to base how you ration out healthcare on some sort of ethical theory, otherwise you probably don't believe it's very fair. So equitable access to health services is addressed by the theories of market and social justice. These two contrasting theories govern the production and distribution of healthcare services in the United States, and again, not so much in other countries. Let us revisit some social versus market justice components. In social justice, it is concerned with the equitable distribution of healthcare, and it sees that as a societal responsibility. On the other hand, market justice sees that market forces in a free economy are responsible for achieving a fair distribution of healthcare. So in other words, we are relying in market justice on the market to do this. And since in the U.S. we have a combination, it's hard to know who's supposed to be doing what. On the social justice side, healthcare is seen as a social good, kind of like clean air. Whereas market justice, healthcare is an economic good, kind of like a yacht. So now when you combine those two, what is it? Is it everybody deserves a yacht? Or what? So finally, we have social justice, which believes in planned rationing or supply side rationing. In other words, controlling providers and the distribution of healthcare so that it equals it out and it seems to be fair. Whereas in market justice, that rationing isn't planned. It's demand side rationing, price rationing. The market forces take care of everything, just like the stock market. There are more comparisons one can make between social justice and market justice. In social justice, there has to be central control by the government. There's simply no other way to do social justice-based healthcare systems. So if we wanted one, we would have to change. We have a lot of market justice going on right now where we believe our health is our fault. In some ways that's true. We have our behavioral risk factors, but can we really control so much our air quality? In market justice, you got to listen to your physician because he or she knows what you should do and the market knows what you should pay. And so therefore, you have to go shopping. Social justice is pervaded with this concept of a collective good, while market justice does not operate on that concept. In the U.S., we really just don't see healthcare as a collective good. We don't believe that person A should have to pay ever for person B's healthcare, the way we see other sorts of situations. There are more comparisons. In social justice, there are certain characteristics which are on the left side of the slide, and those bring about certain implications which are on the right side of the slide. The important implications include a collective responsibility for health. These implications mean that if you set up your healthcare system around social justice, people will believe that everyone is entitled to basic package of benefits, that there will be this strong obligation to make sure everybody has that. The community well-being will be held up high and will supersede that of the individual. Public solutions will be crafted to social problems, and through that there's planned rationing of healthcare to just make sure everybody's got the little piece or the sort of big piece that some people need. In market justice, we have the characteristics on the left side and then the implications on the right. Of course, these characteristics bring about different implications. This looks a little bit more like our system, where there is more of an individual responsibility for health, as is seen when we are encouraged to lose weight and quit smoking, and also we have to pay a lot of co-pays and deductibles when we use healthcare, even if we're part of a health plan. Benefits are based on individual purchasing power, so we punish those people who don't have very much money. We believe they deserve less healthcare. There's this limited obligation to the collective good. We sort of are in it for ourselves. If I manage to get a health plan and get access to healthcare, that's all I care about. I don't care about the other people in the United States, because I don't care if other people in the United States have a yacht. They can go get their own yacht. And that's sort of how we see it. Emphasis is on individual well-being and private solutions to social problems. How many charities do we have? How many foundations do we have? Have you ever had a friend become injured and then somebody sets up fundraisers for them? Well, those are private solutions to social problems. And rationing is based on ability to pay. So the reason we set up fundraisers for our friends is we want to empower them with the ability to pay so they can go access health care. They can be one of those people that health care is rationed to. Are there goods in the U.S. that are seen in the social justice paradigm? What are some of these? Are there things that we just believe everybody should be able to have? In the case of a flu epidemic, do you think the market or social justice approaches would do a better job of containing the epidemic? Do you think that if people can pay for flu treatment that they should get it, and the people who can pay, they don't get it? What about social problems like teen pregnancy and substance abuse? Would market or social justice be more likely to do a better job? Because it's clear that market justice rationing is a worse deal for the individual than social justice, right? Because in social justice, everybody gets a little piece, and market justice, if you can pay, you get it. And there are not really gradations on basic care, like either you get your arm sewed up if it's cut or you don't. But market justice rationing could be better for the population, right? I mean, is that possible? But there are still limitations. Market justice just fails to rectify human concerns and social problems such as crime, illiteracy, and homelessness, which can significantly weaken the fabric of society. Yachts have nothing to do with that. Really high-priced things have very little to do with these problems. And so therefore, if you take something like water or air or healthcare and you put it in this context of market justice, you end up with a lot of social problems that healthcare can't weigh in on. It also does not protect the society. When you think about it, if you limit healthcare to those who can afford it, sometimes those who can't afford it cause the most trouble in society. If I can only refer you to the statistics about the rates of severe mental illness in prison inmates. Those people often assaulted people or damaged property on their way there, but they wouldn't have had to do that if they had had proper health care. Individual health issues can have negative consequences on society, and it really doesn't work very well in healthcare delivery because you want to take care of the population. If you're a doctor, you don't feel good when you just treat a few lucky people and your whole population suffers. And besides, in the United States, don't we have a higher aim? Don't we want everyone to have quality of life? So what are we? The U.S. is not really a market justice system. Healthcare does not follow free market principles. And there's been a shift away from market justice since 1965 with Medicare and Medicaid, and we're even shifting further away from it with the Affordable Care Act. In the U.S., the market and social justice components complement each other. You have this provider-employer-based insurance driven by market justice, and then you've got Medicare, Medicaid, and workers' comp driven by social justice, because we've all felt like at least those people who qualify for that need it. The public health system offers an infrastructure that can be augmented for social justice health care, but we seem to be kind of ignoring that one. The textbook mentions Robert Wood Johnson's Turning Point initiative to create a third sector. Maybe that's public health, maybe that's what we need to do. Maybe we need to look more towards the British system. But it's hard because Americans really just don't want to be taxed to pay for health. The third of the three basic strategies in the U.S. to improve health involve focusing on determinants. Who has the determinants? And what can be done to remove determinants of bad health from these people? So, in order to answer that question, we classify things in this way. We look at social and medical points of intervention. We look at social determinants of health, so social things that determine bad or good health, and then we add to them medical care determinants of health, and then between those we end up with some social and medical points of intervention. For example, social determinants of health may include demographics, socioeconomic status, personal behavior, community level inequalities on health. Imagine you live in a community that's kind of depressed and you don't have a lot of good health care providers. That could be a social determinant of health. Imagine you live in a community that has a lot of violence. That also could be a social determinant of health because maybe you don't go out as much. Maybe you don't go for walks and you don't meet people in your community and you're not as socially connected. As patients move across the spectrum, they are likely to contend with fragmentation, poor continuity of care, insufficient care, and coordination for all health needs. In general, even if one is on an MCO health plan, as one goes through life, it's very hard to get a continuum of care just because the healthcare system changes so fast. If you happen to have some of these social determinants for bad health, you'll get a lot more disparities in quality. Social or medical care policy interventions can work on a broad scale. For example, the Affordable Care Act. That is a big social and medical policy intervention. And certainly it's going to change things. But we don't have to wait for the president to do things. We can do things at a community level. Community-based interventions can change the health of a whole community. And then you have health interventions that can be just done and available in the community to whoever wants to use them. For example, a community-based intervention might be a community education campaign about adults serving alcohol to children and what the penalties are to try and reduce that behavior. Whereas a health intervention could be set up whereby teens can go to Alcohol Anonymous for teens, and then that way they can quit if they have a problem. At the end of the day, there are individual interventions, just like individual therapy or going to the emergency room and getting individual care. So we have these four categories of places where we can do social and medical points of intervention and try to work on the health of individuals and the population. To go on about social and medical points of intervention, here are some examples of these four levels of interventions. Important policy interventions include safety regulations, screening food and water, coming up with safe work environments, and OSHA, of course, is wonderful. Community-based interventions, like I was saying, try to attack health disparities at the community level, and resources can be spent on community interventions that go a long way. If a community is having trouble exercising simply because there are no sidewalks, a community-based intervention to add them and to start walking groups is not a bad thing. That could go a long way. Healthcare interventions are important. Implementing electronic medical record systems could save $77 billion per year by improving efficiency. So that's a healthcare intervention that could save money. Also, just simply coordinating the care and counseling for a type 2 diabetics improves blood glucose management. It probably also improves the diabetics' outcomes, long-term outcomes, because people with diabetes can get worse problems just from having the diabetes. So at the end of the day, working on healthcare at the healthcare level can fix things, but also at the end of the day, you also have individual level interventions. We all are responsible at some level for our own health. We have to look at what we're putting in our bodies and what we're doing with our bodies to try and keep ourselves healthy. But the other three, those are things that have to be addressed at a more group level. There are a lot of individual strategies to improve health and reduce disparities. I talked about three main ones from the big U.S. that's trying to deal with this big U.S. healthcare system with all these people and organizations and subsystems and all these uninsured people and special populations. But here's just kind of a toolbox of what we use in public health to try and reduce disparities. For example, just nutrition programs. Some people don't realize that there are places where you can live in a city and not be able to get very good fruit. I just was at a clinic today and I saw that they were having a little farmer's market inside with fruit. So people who worked at the clinic or came to the clinic could buy fruit. That's a nutrition program. Work in environment safety efforts. Simply just going in and making sure everybody has their safety equipment and is using it can go a long way. Community-based partnerships, especially with private industry, can work. If you want to get people exercising, partnering with the gym can help. Culturally appropriate care. If you're in an area with a lot of Brazilians, make sure that people speak Portuguese. Patient safety, medical error reduction. Just make sure that you're giving the right drugs to the right people. Prevention-oriented efforts go a long way. They are cheap. Putting up a fence is a lot cheaper than trying to put somebody back together after they fall. Finally, coordinated care for chronically ill persons is really nice for the chronically ill person because the chronically ill person already has a million appointments. So trying to coordinate that around them so that they can have optimal health makes them very happy, and by the way, it's cheaper. In the end, health determinants are multifactorial and they all interact. And currently our healthcare in the United States is really illness focused, but efforts are in place to use holistic approaches. We are going to try to use the primary care model to try and approach people as individuals, as holistic individuals, and care more about their quality of health than just the quality of our medical procedures. We are taking responsibility over our own health, which is important. But we as the United States are also trying to take responsibility over everybody's health by shooting for Healthy People 2020. The U.S. healthcare system is transitioning towards social justice, and it is critical to address social and medical determinants of health in order to get to a healthier population. Now we have reached the end of this lecture, and you should be able to name at least one definition of health in which organization has put it forth. Describe what holistic medicine is. Give at least two determinants of health. Give an example of how American values have influenced the U.S. healthcare delivery system. And finally, you should be able to describe at least one strategy used in the U.S. healthcare delivery system to improve health. I hope you enjoyed this lecture over Chapter 2 and now better understand the foundations of U.S. healthcare delivery. You learned about indicators and determinants of health. While these are global things, global indicators and global determinants, you will see in this lecture and in subsequent lectures how we handle those things differently in the U.S.